So let's side roads special, lit up with decorations and lights all across the state. Now, some communities are already doing this. I saw that Stowe had posted something similar on social media, and there may be others as well who are way ahead of us. And I thank them for doing so. And this will only add to that as a joint effort. Of course, knowing that social media could use a whole lot more optimism and hope than we're seeing these days, we'll also be asking you to share photos and videos of your homes and favorite decorations on Twitter, Facebook, and Instagram by using the hashtag VTLightsTheWay for the rest of the world to see. And we'll be working with businesses, nonprofits, and media partners to help us spread the joy as far and as wide as possible. But we need Vermonters to pitch in, and that's really the key. Together, we can celebrate this season and remind each other that there are, in fact, brighter days ahead. And I believe it's not that far into the future. We can make a once-in-a-century pandemic holiday season a truly unique and memorable one for our kids in a fun and positive way. And we can show the nation that, once again, Vermont lights the way. With that, I'll now turn it over to Secretary French for this week's education update. He's joining us by video. Secretary French.
Thank you, Governor. Good morning. We completed the first phase of our surveillance testing for school staff last week. The preliminary data indicate approximately 9,389 tests were administered, and the tests identified 21 positive cases of COVID-19. The logistics behind the surveillance testing in schools are complex, involving teams from various state agencies, including the Health Department, the Agency of Education, the Agency of Transportation, and the Department of Safety. The Vermont National Guard also played a critical role. Our school districts managed the rapid deployment of the testing very well, and I want to thank them for their work in this effort. It's a good example of how our state and local partnerships have served us so well during this pandemic. Michael Clark, the superintendent for the Grand Isle Supervisory Union, sent me an email describing how things went in his district, which, as folks should know, has some fairly unique geographical challenges from a logistics perspective. In his email, he wrote, "As a small SU, this appeared like it was going to be a huge lift for the Grand Isle Supervisory Union, mostly because of the timing and the sense of overload we're all feeling. However, our district nurse and I successfully ran 4 surveillance testing clinics in 4 different buildings with the support of the health assistant at each site. While there were minor glitches, everyone who participated was grateful and expressed appreciation as a sense of comfort that we were all participating. The Vermont AOE was a solid partner in helping us pull this off. Our AOE project leader was Jill Briggs-Campbell, and she was fantastic at answering questions and helping us smooth the AOE, AOT, and National Guard side of logistics. AOT and National Guard also really came through. We tested 91 faculty and staff members, which is more than 50% of our faculty and staff. Overall, the project was a great success for us. At the agency, we are now organizing the next phase of this testing with our partners at the Department of Health, and that testing will take place in the month of December. We'll take the lessons that we learned from the first phase to make improvements in the logistics and also the communication and support to school districts. During this next phase, we'll test 25% of our districts each week, starting next week. Each testing group will include a sample of our districts from a geographic perspective, so we'll have insight into the prevalence of the virus across the state on a weekly basis from the testing. This surveillance testing will be an important strategy for us to ensure the safety of our schools during the holiday operations period that began with Thanksgiving and now will extend through the first of the year. We provided guidance to school districts on Monday on how to implement the recent addendum to the governor's emergency order that prohibits multi-household social gatherings associated with holidays. Our guidance allows schools to include a question in their daily health check questionnaire on multi-household social gatherings. Our guidance also allows schools to exclude students and staff who have participated in such gatherings from attending school in person until they have satisfied quarantine requirements. We believe it is important for all Vermonters to be responsible during the holiday season and follow the gathering requirements of the governor's executive order. Schools are concerned that not all members of their communities will do so. Our guidance is designed to provide them with another tool to help them keep our schools safe. That being said, it was reassuring to see in a recent New York Times article this week that about 80% of Vermonters plan to celebrate Thanksgiving with just the members of their immediate household. This was one of the highest rates in the country on the survey, second only to Washington State. I think this underscores how willing Vermonters are to do what it takes to keep our communities and our schools safe. Our focus for the next several weeks through this holiday period will be to ensure the safe operations of our schools for in-person instruction. As new information about vaccines comes out, we'll begin to make plans for putting more effort on addressing the educational impact of this emergency on our students. A key aspect of that work will be to assess the impact. We learned this week that the National Assessment of Education Progress, or NAEP, will be canceled this year. NAEP, which is sometimes referred to as the nation's report card, is the one assessment that is administered in all states. We've been waiting to a certain extent for the resolution of the presidential election to pursue further discussion of state testing policy, including the administration of our Smarter Balanced Assessment, or SBAC. We are now starting to have those discussions in partnership with other states. There are two main themes to these discussions. On the one hand, the data from state assessments like SBAC help identify equity gaps, and we know COVID-19 has most likely exacerbated those equity gaps. On the other hand, schooling for the last 8 months or so has been far from normal, and so we know the results from any state-level testing will represent those challenges from an accountability perspective. Also, it's unclear at this point what school will look like come spring when these assessments are typically implemented. So at this point, we'll have to see how testing policies will be addressed at the federal level. It's too early to decide how Vermont will approach testing in the spring, and to a certain extent, our decision will be influenced significantly by the federal government. At the same time, we need to start planning for how to assess the impact of this emergency on the education of our students. And I would define education broadly to include not only academics, but also their social and emotional well-being and overall healthy development. I expect that work to begin in earnest after the holiday period. That concludes my update. I'll now turn it over to Commissioner Shirley.
Yeah, Commissioner Sherling, you're on mute either on your end or on ours. There you go.
I think we've got that sorted out.
Thank you.
Star 6 to unmute. That's a new t-shirt here in Vermont. Good morning again. I'd like to take an opportunity just to provide a couple of brief updates. First, on health and safety assessments that have been occurring over the last 2 weeks. Statewide, over 1,200 have been conducted. Just a handful have resulted in findings of issues that relate to health and safety that have been followed up on with businesses, primarily focusing again on lodging and restaurants. We expect that those proactive assessments will come to an end later this week, and we will remain in a reactive mode, providing education based on tips that come in both through public safety channels and via the Department of Health. On a slightly more somber note, I'd like to take a moment to highlight a situation that emerged over the last few days in the St. Albans barracks of the state police. This is an example of innocent vectoring that can occur and why the health and safety posture that's been created for Vermont is so essential. This event started with a significant other of a trooper who was in the healthcare system getting a surveillance test, not based on any symptoms, but a normal surveillance test that occurs in the healthcare system. And results that were received on the 21st, just last Saturday, indicating a positive COVID test. The trooper who is affiliated with that person immediately went into isolation. However, going back into what could be a period of time where that person was could potentially spread the virus to others, We determined that there were 2 contact events where 15 minutes of contact with folks while on duty occurred. One was the interview of a person that occurred on Friday the 20th, and the other was an operational briefing that occurred prior to the test result coming in on Saturday the 21st. The person who was interviewed has been contacted, and in that informational or operational briefing that occurred, there were 15 additional employees who were present working on the execution of a search warrant. Those folks, as a result of that potential exposure, were also put into isolation, which of course impacted the operations of the St. Albans Barracks, requiring that teams from other areas of the state police backfill shifts and ensure coverage. We anticipate that those folks will have reached their 7-day period where they can test later today. So they'll be tested with results hopefully coming back within the next 24 to 48 hours. And I think I skipped one of the most important things was that the trooper who had an exposure did test positive, that test occurring on Monday the 23rd, with the results coming back on Wednesday the 25th. A final note, we have added some additional operational posture changes to ensure additional safety measures going forward for all public safety operations. But again, this incident highlights the importance of all the health and safety guidance that's in place now, and despite the fact that we have a strong operational posture and procedures in place to try to prevent vectoring of this nature, sometimes the timelines interfere with that, and these kinds of events can happen. So that's why it's so important to follow the guidance as it's been prescribed by the health department. Thank you. That's my, I think now we turn it over to Dr. Levine.
I hope everyone who's listening had a great Thanksgiving and found creative and novel ways to both enjoy themselves as well as stay connected with friends and family, and maybe even contribute in some way to the pleasure others less fortunate may have had. Regarding the holiday and its potential impact on Vermont's future COVID case counts, I, like Secretary French, was heartened by the New York Times survey conducted through the country, which stated that only 27% of Americans plan to dine with people outside their household. That survey was slightly less than a number of other surveys that have been conducted by other entities that estimated about 1/3 of Americans planned to do so. Such surveys probably underestimate reality, as people don't always want to freely admit doing what they've been told not to do. And of course, airports, as we've seen, have been at their busiest since the national emergency began. Nonetheless, the 3 regions in the country with the fewest people planning to dine outside their households were Washington, D.C., Washington State, and Vermont, at about 20%. From my viewpoint, I hope we achieved even lower. We will learn more in 7 to 14 days. Most of us in state government observed the different feel of the holiday this year, the lack of traffic. The airports reported lower holiday and pre-holiday activity. My request to Vermonters who may have participated in travel and or multi-household gatherings is simply this: please quarantine yourselves at home, and please get tested now and in 7 days. In terms of our case counts, on Wednesday there were 72 cases, and as the governor just stated, 3 deaths reported. 2 of those deaths occurred on November 24th and 1 on November 22nd. The individuals' ages were 76, 81, and 94, and 1 passed away at home, 1 in a hospital, and 1 at a long-term care facility. We express our sympathies to their families. This brings our total deaths to 67. Yesterday, there were 99 cases and no deaths reported. This brings us to yet another landmark the 4,000 case milestone. Unfortunately, 4,005 cases to be exact. In terms of hospitalizations, there are currently 16 Vermonters hospitalized with COVID, none under investigation, 2 in an ICU, none on a ventilator. The health department and I are becoming more and more concerned about the increasing number of cases that we're seeing in nursing homes and other long-term care facilities. This is causing more patient illnesses and hospitalizations and even deaths, more staff illness and required quarantines, and frank staffing shortage in a time of national shortage for these facilities. The most recent skilled nursing facility to have an outbreak is Elderwood in Burlington, where included in yesterday's positive results were the results of facility-wide testing. Their current case numbers are 14 residents and 2 staff. We all know the way COVID spreads through such vulnerable facilities in an often stealthy manner. And almost universally, the virus comes in via an unsuspecting staff member who may have no symptoms at all, or who develops symptoms but might have worked as usual for the 2 preceding days before their symptom onset. Because that's how this virus takes advantage of us and operates. So I raise this issue today because I want to again re-emphasize the major way we have to protect these facilities is by protecting our communities, lowering the ability of the virus to spread from one person to another. And that is by continuing to avoid gatherings of any sort, especially multi-household gatherings, as well as, of course, avoiding all non-essential travel, and certainly if one does have to travel, avoiding travel without subsequent quarantine. Obviously, all of our same guidance continues to hold and continues to have increasing validity to it, especially the masking, where more and more evidence is coming out and being published almost on a daily basis regarding the success of that initiative. In addition, we'll be increasing surveillance activities in the long-term care facilities, as well as in other healthcare settings. And speaking of surveillance, you heard Secretary French comment on the teachers and school staff with 21 positives out of almost 9,300 individuals. That comes out to a 0.24% positivity rate. Through the 24th of this month, our average percent positivity rate over a 7-day period was 1.24%. That literally means a little more than 1 in 100 chance of being positive on a test. Now, a lot of people talk about the fact that the more you test, the more cases you find. And in Vermont, we are finding cases at higher numbers than we have before. We are also doing incredible amount of testing, and now that the college student testing will be diminished because they've gone home on break, we will still have abundant more surveillance testing in the populations I've already mentioned, as well as our on-demand test sites throughout the state. Keep in mind that someone who has no symptoms can test positive at one of these sites. So we feel pretty comfortable with our low percent positivity rate at this point in time, because even as there's a surge in the country and in the region and even in the state to some degree, we're not just learning about the people who feel ill and went to get a test because they felt ill. We're learning about people who went to get a test because they may have been in a gathering, they may have traveled, or they may have other concerns that indicate that they were in contact with someone with COVID. Some of them will have no symptoms but test positive. So our percent positivity rate gives us a very nice finger on the pulse of how much COVID is present in our state. Now I'll turn it over to the governor.
Thank you, Dr. Levine. We'll open up to questions at this time.
All right, we have 23 in the queue today, and we'll start in the room with Calvin.
Thank you, Governor. So the proposal from earlier this week to have schools ask students if they gathered over the break, we're already hearing from a number of districts that are choosing not to ask students next week. It's gotten, of course, you may have seen, it's gotten some national attention as well. I'm wondering what you make of the response to this policy, and maybe in the sense of you think it's backfired.
Yeah, well, I don't think it's backfired at all. And I think it's important for us to reflect on what we're asking. A lot of the folks who are watching today may not understand this, may not have kids in school, but for those who do understand the process very well, we have a health check that is implemented and utilized by every student going back to school every single day. Health check on whether they have a fever, whether they've been sick, and a series of questions. When we determined that we were going to push pause on any travel into the state, a question was asked, added to that health check. Have you traveled out of state? That was on the form as well. When we determined that in Washington County over like a month and a half period of time, that 71% of all the positive cases were coming from social gatherings, we determined that we needed to limit the number of social gatherings, especially with Thanksgiving coming up, especially with what we saw happen in Canada, the incredible rise in the number of cases as a result of travel and mobility around their holiday. So we asked the districts to add one more question. And if you had if you were going to have a gathering with households outside of your household, we were asking you to tell us that. And you don't even have to get to that point. I would say if you have had one of those gatherings yesterday, that you shouldn't send your kids to school next week. That you should quarantine your kids for at least 7 days, get a test, and then we'll move forward. We did all of this to try and protect Vermont, to try and prevent the rise in number of cases. Now, admittedly, there was a lot of reaction to this. We saw it on social media. We've had many calls. I think you can chalk that up to either hitting a nerve. It's either a guilt nerve or just a resistance nerve. But the intent was really to protect Vermonters. And because we're seeing so much community spread, that we had to put a stop to it somehow. So this is something the districts can do or don't have to do, but we're advising that they have it as part of the questions. But again, I will reiterate, if you had a gathering yesterday that was where you had people outside of your households, I would quarantine your children over the next 7 weeks or 7 days, and then have a test. And then you don't have to be asked the question. Yeah, but as well, I mean, for those who are listening, this isn't like an interrogation of your kids. For most districts do this online. They ask the parents to attest to this. So the parents are the ones who do fill this out, and then they do it online. Now, if they don't do it online, it does get down into in-person, or a note is sent in with their children to the schools. But for the most part, it's all done online, and it's done by parents.
Liz?
Hi, Governor. Today's obviously Black Friday, tomorrow's Small Business Saturday, and a lot of Vermonters are probably planning on spending some money at our local retailers in the coming days. How can they do so safely?
Yeah, you can adhere to the guidelines we put into place. Many of the retail operations, if they can just make sure that they're spaced apart and do so in a safe manner, everyone masked up. And if you're sick, if you have symptoms, don't come in, don't shop. Just take the necessary precautions, because we understand that especially tomorrow with some of the smaller retail operations, Small Business Saturday is important to retailers. And I would contend you could do it in a safe way but it's not going to be the same way you've done it in the past. But just follow the guidelines, a simple procedure, and we'll all, and not crowd into, the retailers themselves will have to determine how many people can come into their place of operation. But I'm confident we can get through this, and I think everyone's taking this seriously, but we don't want to inhibit them, their ability to shop either, or for the retailers to do business.
Are you encouraging people to do more online shopping this year then, just because of the pandemic, to social distance easier?
I think what I am saying is we need to spread this out. Maybe not everyone do it all at once, and to use every day as an opportunity if they want to do it in person, especially with some of the small retailers. Just don't do it all on Saturday. Maybe you can do it on Sunday or Monday or Tuesday or Wednesday. Just spread it out a bit and going during times when it's not as busy. And it's just going to have to be a little bit more creative. I've seen some businesses that have used their entrepreneurial spirit and creativity to do things in a different way that's going to be unique, but at the same time, I think it will keep people safe.
Thank you.
Secretary of Information.
Oh, sure, go ahead.
Okay, yeah, I think you had such a great answer. I just wanted to share with folks who are listening that Vermont retailers have worked incredibly hard to try to provide customers different kinds of access than they have in the past. They've upgraded online shopping platforms. They are happy to take orders over the phone and provide curbside as well as some delivery. So we are really hoping that folks do support our local businesses who are relying on you this holiday season. But again, as the governor has mentioned, we want you to do it as safely as possible. And again, look for a variety of ways that will prevent you from gathering and congregating and creating large crowds.
Yeah, thank you, Secretary Curley.
This could be for you, Governor, Dr. Levine. We have seen the increase. We actually got tipped a little bit on some of the nursing home breakouts. Are you concerned, or what is the strategy here? Have either healthcare workers dropped the ball a little bit, or dropped their guard, or is it folks coming into these facilities that might be the problem here? I mean, what's the concern as far as where we're at with that?
Thanks, Steve. I would say it's neither. The visitation policies still remain pretty strict. And as the weather has cooled off and the rate of disease in the communities has increased, it's only gotten stricter. With regard to the healthcare workers, I would hate for anyone to point the fingers at the healthcare workers because the reality is, as both the governor and I have said today, they all have lives away from work in their communities. And I don't believe they're indiscriminately attending social gatherings that they shouldn't be, or leaving the state and coming back without quarantining. They're just subject to the same forces we all are, that they may come in contact with people who have the virus, who have no symptoms and don't know about it. And that's just the reality of where we are. The nice part about the data I gave you on teachers, I think if we looked at the overall data on healthcare, as we pick up the surveillance there, we would find something similar, that we're going to have a very low rate of positivity in those groups because they're really invested in keeping their work sites clear, whether it be a healthcare work site or an education work site. They don't want to shut down the operations at any of those or impact their colleagues who would have to quarantine if they were in contact with them. So I think it's just a sign of where we are really in the whole region with regard to COVID.
Thank you.
I'd also add, as Dr. Levine reminds us, that when the disease is prevalent in the community, that we're going to see more of these outbreaks. It's just part of the nature of the virus. As well, this virus is so crafty, with a number of people, a high percentage, being asymptomatic. So people are unknowingly going to work, but are positive and can be spreading unknowingly to others. So it's not as though they're doing it intentionally, but that's why we've continued to upgrade and to branch out in terms of our testing, on-demand testing that we've done over the last week and continue to do over the next few weeks, just to get to more people so that we can, and the surveillance testing, which will be really instrumental in trying to get a handle on this.
Pat, WCAS?
Good morning. I actually have another question about the long-term care facility outbreaks as well. There was some really helpful data that on Tuesday that broke it down really nicely about which facilities had cases, how many there were. Could you update us on that data today? How many facilities have cases right now? Which of those incidents are considered outbreaks?
Yeah, I don't know if Secretary Smith might have any of that information, or it may not be upgraded today because of the Thanksgiving holiday. I may ask Secretary Smith if he has the answer to that.
Yes, Governor, you are correct. It hasn't been updated today. It would normally be updated, but Kat, it hasn't been updated because of the holiday. What Dr. Levine gave you was the addition of the long-term care facility at Elderwood with the 14 positive in residents and 2 staff. I don't have updates on the rest of them.
Got it. While I've got you on the line, Secretary, can you just reiterate for people what the visitation policy is at the moment for long-term care facilities? Like, are there any facilities that are actually allowing in-person visits at the moment indoors, or given our case counts, have we pretty much stopped doing that at the moment?
Given the case counts, we've pretty much stopped doing that at the moment. Most, if not all, skilled nursing facilities have restrictions on visitation, and so I think those will continue until we get the prevalence of the virus in the community under control. We also have stepped up testing in long-term care facilities to weekly now, and may even go even more further than weekly. So we are testing staff weekly. We have put fairly significant restrictions on visitation, just to try to keep these facilities safe.
Thank you.
Joel, the Burlington Free Press? Joel, it's *6 to unmute. Our last call for Joel. We'll move to Mike Donahue at the Islander.
Yeah. My *6 button seems to be soft. Can you all hear me now?
Yeah, go ahead, Joel. We'll get back to you, Mike.
Okay. Governor, it sounds like in the medium term, like in the coming year, there is cause, at least cautious cause for optimism with vaccines and so forth. I was wondering when your administration might begin, or maybe it already has begun, establishing what protocols might be useful to implement and have ready for the next pandemic, if it comes in 5 years, 10 years. What aspects of the economy and the health establishment, or health professionals anyway, might be put in place in anticipation of something that is almost certainly going to return? Or is your administration just so caught up right now in what's working now and what isn't? But I'd be interested in knowing how state government is going to change as a result of this, and whether or not some things are being bookmarked anyway for the future.
Yeah, you can look back to the start of this and how we've evolved since the very beginning. We've learned so much. and we've tried to be strategic in some of the guidelines, restrictions we've been putting into place of late, because we know what works, what doesn't, and how the virus acts, and learn more every day. But we're going to have to continue to evaluate after this is over to see what we do in terms of protecting ourselves for the future. As well, we're going to be through every type of situation, whether it was Irene. We learned a lot from Irene, and we've put in a lot of steps, mitigated a lot of areas of concern in terms of flooding and so forth that we're continuing to do today. So we learned from that and did things differently, so we didn't end up in the same situation if we had another when and if there's another flooding event. As well, with this virus, we're going to do things differently. Across state government, for instance, I think being remote, working from home, is going to become more prevalent that even after we have the vaccine in place and we get back to somewhat normal. That will be the new normal for a lot of folks across state government. So we'll glean as much of the good, all the silver linings, and there are many throughout this pandemic. We may not see them right now, but they will surface as we move our way out of this, and then we'll learn from this experience, and we'll learn what works and what works better, and we'll continue to do that. So again, it's a little too early to plan for that, but at the same time, we're keeping track. And again, we do this every single day to reflect on what's working, what isn't, and what we can do to help ourselves.
Well, I understand, and we'll all stay tuned, and thanks very much for your time.
I'm going to let Dr. Levine add to that.
Just to give a tiny addition, you're right, there will be another pandemic. I hope 5 years is not as soon as it comes, but looking at the pace of things over the last 20 years, possibly. But the reality is, I think the lesson that needs to be learned the most is a national lesson. And again, I'm not pointing at one administration or another, because this spans a number of administrations over the last 20 years, to be accurate, where funding for pandemic preparedness and emergency preparedness from a public health standpoint has not been valued, and it's actually been actively taken away over time. So I think the country needs to learn this lesson, because a state like Vermont, like every other state in the country, is dependent upon federal funding that usually filters down through the CDC and then gets apportioned to all of the states. And these activities are valued and important, but they can only be as robustly funded as the federal funding that comes into the states to help support them. So I think that lesson will be clearly learned, because other pandemics or potential pandemics didn't really impact anybody in the way this one has, whether we're talking about the H1N1 flu, the Zika virus, Ebola virus. None of those have any kind of impact compared to what COVID-19 is all about. So I think as a country we'll learn that lesson, and the states like Vermont will be able to have even a more robust response. Not that we didn't in the beginning, the next time around.
All right, well, thank you very much.
Mike Donahue, the Islander.
Thanks, Rebecca. First thing, could we get a clarification from Commissioner Sherling on the St. Albans State Police activity? 15 people, I think, were involved in the search warrant. Just trying to confirm they were all state police members, or were there agencies like St. Albans, Swanton Police, Sheriff, federal agencies, or any drug task force that have other police departments represented?
Sure, Commissioner Sherling.
Yes, thanks, Governor, and thanks, Mike. Yeah, it's just 15 folks from within the state police that were present at that briefing.
Okay, good. Thank you. Governor, there seems to be some confusion if indeed deer camp visitation is still a quarantine situation as originally announced, and with the deer season coming to an end, his co-workers are going to be returning to work, and we've heard employers are now saying that only those exposed to a confirmed COVID case at deer camp need to be quarantined. Because of that belief, some have already returned without quarantine, much to the dismay of some of their colleagues. Reader asks for clarification would be greatly appreciated and benefit the general population.
Yeah, from my perspective, if they were returning from deer camp with members of different households, they would have to quarantine. But Dr. Levine is shaking his head. Yes, that's correct.
Okay, thank you. And second question is probably for Commissioner French. The Brigham decision by the Supreme Court requires equal education across Vermont, with students having the benefit of in-classroom experience and some doing long distance and some hybrid. Of course, there's a distinct possibility in the coming weeks that some schools will shut down while others continue, and there is a distinct difference between in-person learning versus long distance. How does the Agency of Education in the state of Vermont plan to ensure children do in fact get the same level of education as required by the Supreme Court? And can you actually give specifics, not just generalities, but specifics how kids in Burlington and Barrie are going to get the same education as Bennington, Brattleboro, Barton, and whoever?
I think that's a great question. Secretary French.
Yeah, thanks, Mike. Yeah, I think it's important to note that the learning of all students, I think, has been adversely affected. As I mentioned in my remarks today, I think the first step in doing that is going to be some focused time on assessing the impact. Unfortunately, right now, it's really hard for us to do that until we have more in-person instruction. So the priority right now is going to need to remain operating our schools safely as best we can, particularly through this holiday period. But I'm hoping to turn the corner on that, particularly with the advent of the vaccine, so that we can put more focused effort on first assessing the impact. And that's why the conversation about testing is so important. On the one hand, it's hard to contemplate how that testing might provide useful information from an accountability standpoint. But on the other hand, we need to have some commonly used assessment tool across the state that allows us to begin to prioritize the impact, particularly from an equity standpoint. So I think the first step will be that assessment piece, but we're not going to be able to start that until after the first of the year.
Okay, thank you all very much. Appreciate it.
Thank you.
Guy Page, Chronicle of the Vermont State House.
Governor, the Supreme Court ruled a couple days ago that the state of New York may not restrict religious practices as part of its COVID regulations. What effect will that ruling have on your executive orders regarding religious services?
Yeah, Guy, we're trying to assess that at this point in time. From our initial standpoint, it appears that this reaffirms that what we're doing here in Vermont is the correct path, that we haven't done what New York has done, and that we have restricted based on occupancy rate, but not those caps that New York did. So I believe, from my standpoint, I think it's good news for Vermont and just reaffirms that what we're doing is correct.
Okay, so you're saying because it's occupancy rates and not caps, we're probably in the clear with that.
Yeah, I mean, it's based on equity, and we're doing it across the board, so it's not as though we're pointing at one particular sector.
Okay, thank you. Second question is, I understand, could you tell me what the development of your thinking is on whether vaccination of COVID will need to be mandatory at some level?
Yeah, it's way too early for that. Again, from my standpoint, just as we see some of these vaccines come into place, we have to prove that they're safe and effective, and we're going to learn a lot. And we don't have enough for everyone at this point in time. It's going to be many, many months before that that is even the case. But I think it's important, and Dr. Levine can probably speak to this better than I can, but it's going to be important for us once we determine that there are some safe vaccines out there, that we ask Vermonters to do this voluntarily so that we can get above a certain percentage, because if we don't get above a certain percentage, it's just not effective to counteract this virus. So there's a rate, there's a magic number somewhere, I think it's around 70%, where if we can get above that, then we'll contain it with this herd immunity of sorts. So Dr. Levine, can you add to that?
Yes, Governor, the number is in the 70-ish% range, give or take a little. It's not precise, but based on what I told you earlier about the percent positivity rates in our testing, we know that there are not going to be large numbers of Vermonters who have already acquired some immunity on their own by coming in contact with this virus. So the vaccine will have to, in a parallel pathway, add to that number. From a federal standpoint, and from all the plenty of advisory panels that are out there, there is no talk of mandating vaccine use in the country. So if a state chose to do that, that would be different. But again, I think it's so early in the game to be talking about those things. I really do think we need to see the uptake. I had a call with a number of hospitals today who have informally surveyed their staff, and they're coming up with 50 to 60% of their staff at this point in time would say that they would line up first for the vaccine. Now, some may say, well, that's not very much. I'm a glass half full person. I would say that's phenomenal, because they don't even know anything about the vaccine yet. They've had a few news reports talking about 90% effectiveness and what have you, but in terms of really an informed consent process where you know everything you need to know about the vaccine so you can make the right decision, you and your healthcare provider, or you're on your own, that's really phenomenal that people already are thinking so much of this, that they're putting themselves in that pool of people who would take it. So I think that will only grow with the confidence that I hope will come from accurate news reports about what is coming out and what it's capable of doing, and the fact that there may be very minimal adverse effects, as we're hearing in the preliminary way.
So it seems like a fairly safe vaccine to you so far, what you've seen?
So far it does, except for the usual things about discomfort at the site of the injection, and perhaps a day of low-grade fever or fatigue in some, but not many. Mm-hmm. But again, I don't want to say that that's gospel at this point in time, because we just haven't got enough information to be accurate about saying that.
Okay, thank you.
Greg, the Bennington Banner.
Thank you, Rebecca. My questions are, I believe, for Secretary French, if that's okay?
Sure.
Okay, my first is about the surveillance testing. I'm wondering if you can tell us where those 21 positive test results came from in terms of which district, and whether any were concentrated in a single school.
Yeah, hi, Greg. The health department will be providing more reporting on that, so I don't have the specifics of where they were, but they were spread out around the state.
Okay, do you know if any were from the two southern Vermont counties?
I don't have that data with me at the moment.
Okay. My second question then is about the question asking folks about multifamily gatherings and having to quarantine otherwise. Is there any indication of how many districts opted out of that question, and did they reach out to you on that, or was there discussion about that sort of in the process? And also, were any of those districts deciding to opt out here in the southern two counties?
Yeah, I don't have specific information on opting out or not. I think that'll likely become more clear on Monday after Thanksgiving. But we did have a lot of contacts with districts as we published that guidance late Monday afternoon.
Okay, can you tell me generally what those conversations were like in terms of what their concerns were?
Yeah, I think it's, starting on, when the executive order addendum was published on Friday, districts had many questions as to, what their role would be in implementing that. Particularly, I heard from superintendents who were struggling with the idea that some parents might be less than truthful. So we endeavored to provide some additional guidance for them, and that ultimately culminated in the publishing of our guidance on Monday. But this balance, districts are trying to strike between sort of, I won't say enforcement, but more in the lines of implementing the guidance as a tool for them to keep their schools safe. So on the one hand, schools felt challenged, I think, to go beyond what would be their traditional authority. On the other hand, they do have authority and responsibility for ensuring that everyone in their school buildings is safe. So I think as you saw in some of the media coverage, there were some superintendents who were looking for more specificity and additional tools and guidance from the state, where others felt within their own current authority that they had the ability to navigate the issue. So it's hard to, challenging issues the governor alluded to, but our bottom line was, I think we're just trying to keep everyone safe and equip schools with the tools they need to do that.
Okay. Thank you very much. That concludes my question.
Greg, the county courier.
Good afternoon, Governor. Just a quick follow-up on the state police situation in St. Albans. Was that linked to any long-term care facility outbreak?
I don't have that information. I think Commissioner Sherling, I think you said that there was a connection with a healthcare worker, but I don't know in what setting that was.
That's correct, Governor. It is a healthcare worker, but that's all we know. I don't have that level of granular detail.
Okay. And I guess my second question for the day, we've heard about an outbreak at St. Albans Health and Rehab. I'm wondering what you can tell us. Obviously, the outbreak at the Rutland facility wasn't disclosed until it was brought up by media. So what can you disclose about the outbreak in St. Albans?
Again, I just want to correct the record on that one, Greg. We did disclose that Rutland Regional had an issue as it was unfolding. I mean, it happened quickly. So I think Secretary Smith did mention that during that briefing, but again, it spread.
He did, but it was in response to a media member's question, specifically asking about the Rutland facility. So I guess I'm wondering what's going on in St. Albans, because it seems like we don't always hear about the outbreaks until they're brought up in the media.
Sure.
Greg, we have also, just for the record, added the weekly update, which was presented on Tuesday, with all of the long-term care facilities with an outbreak.
Commissioner Levine.
Governor, I can, wait.
No, it's okay, Secretary.
Governor, you're absolutely right. I mean, that situation was breaking. I was getting texts during the press conference on that situation. It was breaking as we were holding the press conference. The question came up. I answered the question in terms of what I knew at the time. So we weren't the situation was a breaking situation at the same time. St. Albans does, I'll leave it to Dr. Levine to update, but I don't have an update, but I think there are some cases in the facility that you just talked about. But Dr. Levine?
Thank you. And I don't have an update for the last day or so, but I was aware of a case there. And it was, again, very similar to what I've described today in my opening remarks. Somebody who worked while asymptomatic, only to become symptomatic and find out that they were indeed a case. So again, I think rather than pointing at one facility or another, we need to just accept the general theme that there's a prevalence of virus in the state and in our communities, and people, no matter where they go to work, are going to go to work feeling fine, not realizing they're capable of transmitting the virus to others.
So am I hearing from you that as far as the state knows, it's only one case at that facility?
No, only as far as I know this moment. I suspect we may know more than that. I just don't have that information in front of me right now due to the holiday.
Okay, perhaps your office can get back to me on that today?
Absolutely.
Thank you. Thank you, Governor.
Pete Hirschfeld, VPR.
Dr. Levine, the 21 positive results from the surveillance testing in public schools, have any of those results initiated an investigation by your department into a possible situation or outbreak in any individual district?
So any positive result in a facility like a school obviously one connects with the individual who is now a case. They are given the proper guidance about what they should do, and then we determine, based on the time we think they may have been infectious, what else needs to be done in terms of contacts to that case that might need quarantine or what have you. So these are handled like anybody who became symptomatic at the school and wasn't a surveillance test but was a case-finding exercise where they had symptoms and wanted to see if they had COVID, and then we find out they do, and we do the same thing. So it's an automatic when there's a situation in a school that we pursue that. Fortunately, it's almost never resulted in more serious consequences within the school, which is great.
But you don't have any concerns at this point about a potential outbreak in a district based on the results of that first round of surveillance testing?
No, not at this point in time.
And then a quick one for Secretary French. I understood really clearly what the upsides would be to standardized testing, i.e. revealing potential increases in inequities. What exactly is the downside to standardized testing?
Well, I think, as referenced the name standardized, the idea that we would get some predictable and uniform results, and I think, the conditions for learning have been so unequal across the state, it really then becomes hard to sort of start to do the inferential comparisons, apples to apples, so to speak, when we've had so many different configurations. I think the other aspect is really about logistics of the testing. I alluded to briefly. It's not clear yet, what the circumstances will be like when we'll actually be able to implement the test. The SPAC, for example, is a computer-based assessment that I still believe requires in-person instruction in order to implement. We're not able to necessarily implement that assessment in a remote capacity. So, those are sort of the big questions, sort of the uniformity of the conditions that we're assessing, and also logistical implementation of the assessment itself.
All right, but it's not that districts might be subject to some kind of sanction or penalty because they didn't perform very well?
Yeah, I don't think so as much. I mean, the ESSA, the Every Student Succeeds Act, is fundamentally different in that regard from the No Child Left Behind Act, but certainly, has a focus on identifying those schools, particularly from a comprehensive needs perspective, so that we can allocate additional federal resources to assist them. But the accountability structure is basically fundamentally different than it was under No Child Left Behind Act.
Thank you very much.
Mark, VT Digger.
He said we're all kind of grasping for some kind of hope out there, but on what are you basing this idea that there's light at the end of the tunnel, given the really grim statistics that you laid out earlier in the week? And, aren't you providing false hope, and isn't this premature?
Yeah, I don't think it's false hope, Mark. I believe, with the vaccines that have come out at a record pace, this is really remarkable from, I think, all of our perspectives. So that's hope. That's good news. What we're doing here in Vermont has been remarkable as well, that we've been able to, even though our case numbers have increased over the last month, we still are the lowest in the nation in terms of many of the measures that we've been highlighting over the last number of months. As well, with what we're learning, what we're doing, we're increasing our testing, we're increasing our surveillance testing and on-demand testing, so that if you want a test, you can get a test. I mean, there are all kinds of things that we're putting into place and learning so that we can better control and mitigate this virus. So again, I think, again, from my perspective, there is hope out there. And again, with the vaccines that are coming to a full view, 2 so far, possibly a third, and there are a number of other vaccines behind them that are being tested at this point as well. So again, maybe it's a glass half full perspective, but I think we need a little bit of hope, and I think this provides it. Commissioner Oveen, anything you can add to that? Gives you hope?
Yeah. I think we've learned so much, and we've come so far. And as the governor points out, we've really been leaders in the country in this. And not that I want us to learn how to live with the virus and still think our lives are normal, but to some degree we've been able to do that in Vermont for a pretty long time. And now if we find the vaccines become a game changer, that'll only get us there that much faster. So I do think that the pace of knowledge and the pace of that knowledge being usable is really, really important. And just to give you a few examples where Vermont has played a direct role, Vermont, for that one report about contact tracing and how many minutes cumulative you were in contact with someone instead of just the straightforward 15-minute rule, 6 foot, was a game changer for the country in terms of being able to really help protect more people. The CDC is talking now about letting people get out of quarantine sooner than 14 days. And Vermont has, for a long time, had the rule that you can test out on day 7 if you have no symptoms up until that point in time, and that's really stood us well along this time. So we've done a lot, I think, to try to really improve how we have to deal with the virus, and that should be something positive, and we continue to grow in that way. Because optimistic as we are about the vaccine, we know that not every person's going to get the vaccine before Christmas. And there's going to be a number of months that go by in 2021 that we have to endure kind of doing everything we're doing now, plus getting more uptake of the vaccine. But that should be a positive sign for everyone, because it really does mean we can sort of start to plan our futures again. And I see that as something that's very reality-based at this point. So stay tuned.
I had a second question for the governor. Governor, yesterday that the president said that he would honor the results of the Electoral College and actually move out of the White House. A recent poll had 52% of Republicans thought that Trump rightfully won the election. To what degree have his actions and comments undermined the integrity of the electoral process? And what should be done to restore that? And did the National Governors Association do enough on this?
Well, again, I would classify myself in that 48% aisle of those who feel that the election was legitimate, and we should move on. I think this is a sign. Again, I think if you went back maybe 2 weeks ago, that number was higher. So the percentage is moving in the right direction. I think we need to move on from this, all of us, even individually, and focus on what's really important to us at this point in time. I'd say the pandemic is the highest priority at this point, and having the president-elect come in and communicating that, having the Congress be able to really focus on that as well and give us some of the help we'll need, some of the stimulus we'll need to work our way out of this as the vaccine is distributed. Is going to be incredibly important to America. And, as far as what the National Governors Association has done, I think we have tried to work together in many different ways, but I'm not sure that we could do anything different than what was done. I believe the election was legitimate, was safe, effective, and the results will stand. And I think the more governors who come to that conclusion, the better off we'll be, and we're seeing them every single day, and we're seeing other leaders across the country come to that conclusion. And it appears that President Trump has at least come to the conclusion that he will not be in office after the end of January.
So you don't think he's undermined the integrity of the electoral process?
I don't. I think he's put it into question, but I think as time moves on, we will move on as well, and all determine that this was a legitimate election, and we'll see what happens in 4 years. But from my perspective, I think, again, I don't think it undermined it, but it did put a bit of a bruise on it, but I don't think it undermined it.
Thank you.
Tim, Vermont Business Magazine.
Hi, Governor. I have a question about mask wearing, believe it or not. But I just wanted to clarify the three recent deaths. It appears that one was in Orleans County and two were in Windham County. I just want to make sure that's correct.
I don't believe that's correct, but I don't have the data on that. I just don't, and we'll have more as time moves on. But and we can get that to you. But I don't believe that's correct.
As far as the mask wearing is concerned, there's more and more chatter about now that people who have recovered are starting to pile up. There's over 2,000 here in Vermont, but nationally, of course, a lot more. People saying, "Oh, I don't have to wear a mask anymore because I've had COVID, I've recovered, and therefore I'm in good shape, and no one else is going to get it from me, et cetera, et cetera." And I just wanted maybe Dr. Levine clarify that whole point, especially as we go inside more. There's got to be increased transmission.
Yeah, I think it's important to clarify that, because I don't think there's been enough data to show whether you can get it again or whether you can get it again and transmit either. We just don't know enough about the virus.
And I'll concur. I wouldn't want people to think that they're totally invincible if they've had a case. There are more and more cases in the literature being reported of reinfection, sometimes with an actual different strain of the same virus. So I think to protect everyone, wearing a mask is probably not asking a tremendous amount if you've had an infection previously. It'll also save you from being questioned yourself if you're walking into stores without a mask or into gatherings where people would have masks on. Probably save you a lot of explaining and issues like that. But I think with our knowledge of the virus being what it is, it would be premature for people who have had an infection that was documented to think that they don't need to wear a mask, or for that matter, don't need to engage in any of the other guidances that we talk about in terms of physical distancing, etc.
Is there data about whether you're still a carrier or not, whether you can be a carrier, just a transporter of the virus, even if you're okay?
So there is this phenomenon called persistent positive person, which means that even 3 months after you presumably resolved your infection, you felt well for weeks and weeks, but you get tested and you still test positive. Most of those people, we believe, are testing positive because the test is accurate enough to find fragments of the virus, but the virus is not viable and able to infect anyone else. So that partially answers your question, I'm sure, to the best of our ability at this point in time. but doesn't mean people months down the road have the ability to infect somebody else. And that we feel pretty comfortable with.
Okay, thank you.
Can I just add one more thing, because we are entering cold and flu season, and the mask might prevent you from either transmitting or receiving a cold or flu. So we don't need to complicate things right now, and having the flu symptoms is similar to some of the COVID coronavirus symptoms. So it'd be better if we just all wore the mask for now to help prevent the overwhelming of our healthcare system in other regards as well.
Wilson, the Associated Press.
Hi, everybody. As usual, happy Friday, Black Friday at that. I'm curious, I guess this is for Dr. Levine or whoever might like to answer it. Going forward, as people start to get vaccinated, and presumably then they will be immune, or at least 90% of them will, has there been any thought about providing people with cards saying, I have been vaccinated, similar to the inoculation cards that you used to carry with your passports years ago? And if not, do you think those would be helpful to have for things, any number of things that you could use it for? You're traveling to Canada or going into big events or who knows what. So it's a wide open question. So it's probably not a lot of specificity, but I'd be curious about your thoughts about that.
Sure. So from a health standpoint, we're going to have to learn what exactly that means. So if you get the vaccine, we would probably want to prove that you have antibodies that your body has now generated that could fight off the virus if you got exposed to it. And then we'd want to know how long those antibodies would be measurable and still stay good, etc. So that's the kind of stuff we're looking to these trials to help us figure out, because the trials will begin to show over months and months what the person's antibody response is like, how effective it is in the long term. Early indications are that this vaccine would not have to be re-administered, several times in the next year or what have you. It could go years and years. But obviously this is the kind of stuff we have to learn, which would make it very important to, if you were going to have a policy of giving somebody a card, you'd have to know what exactly that card meant. Because just showing a date of vaccination may not be sufficient. So we'll look to some of the national and regional advisory panels to help us with that part. But from another vantage point, I could perceive governments, whether they be state, national, international, maybe having similar expectations. And if you get off a plane in a European country, would they want to see the fact that you had your card with you or not? That's a different level of an exercise when it comes to the policies that governments would actually put up. Hopefully they would be as informed by the kind of information I answered the question with originally from a public health and medical standpoint, so we'd know exactly what they were looking for was reasonable and realistic and was going to protect their population in the way they wanted to. So I think you're a little early with your question, but it's a great question, and it's one that everyone needs to be able to answer shortly after these vaccines come out.
Well, yeah, that's why I asked. I mean, this is starting soon, presumably. I mean, as the new year goes along, I presume there's going to be an avalanche amount, growing numbers of people who will have been vaccinated. And they might want to go to Europe or Montreal or whatever.
Exactly.
So, okay, thank you.
Yep. No, they might want to do all of the above. And that's why the trials themselves will help inform the answer to the question.
Okay, thank you.
James, V.T. Digger.
Hear me?
We can.
Can you hear me?
We can.
Thanks for taking the question. So, the state in recent weeks, you you've taken steps to prepare for kind of the continuing possibility of a surge in cases, including expanding testing over the past couple of weeks in building field hospital in Essex Junction. You also mentioned the sort of new focus on long-term care testing. And I'm wondering with the kind of possibility of continued high cases going forward, what additional measures the state's considering to account for a possible surge?
Well, again, I believe I'm getting the flavor of the question is, you know, what we're doing in anticipation of the next surge.
This is the story of the cult favorite